Good morning. Hi, everyone. Welcome to the CSU Health Network session. We'll get started in a couple minutes. Am I good to start, Zara?
Maybe we can wait a few more minutes, maybe 3 more minutes, and then we'll get started. I still have people going into the incorrect link.
Oh, okay, sure. Yeah, just let me know.
Okay, Arusha, feel free to get started. I do want to share a few housekeeping details with everyone. Thank you all so much for joining us today. This is a partnership presentation with the CSU Health Network. This is a mandatory orientation. We will be recording it and sharing it with you all. We will start off with the presentation and then leave about 30 minutes, maybe a little more, maybe a little less, for questions at the very end. We do have the chat. It has been opened up again. Feel free to communicate. It is only with us host, but we really ask that if you have any questions so that everyone can see it, press, there should be three dots with more under it, and then just go into the Q&A feature. That is where we will ask you all to put in your questions. However, if you have something very personal that you would not like to share, feel free to put that in the chat. But if you put questions in the chat, we will most likely not be able to answer them because we are starting with the Q&A. So again, a reminder to everyone, please use the Q&A feature for all questions. And I will pass it over to Arusha for the presentation. Thank you, everyone.
Hi everyone, my name is Arusha, pronounced she, her. I work as the communication specialist for CSU Health Network. And in today's presentation, I'm going to give you a brief overview of all the services that are provided at CSU Health Network for students, including international students, of course, and then also talk about some new student requirements and recommendations. And I have a lot to cover, so and I'm happy to answer questions at the end. So if you have a question, like Hazara mentioned, please put those questions in the Q&A function. Yeah, let's get started. And I also shared the link of our website, health.colostate.edu, in the chat. So if you want to open that, that will take you to our page, CSU Health Network's page, and you can reference our website as I am explaining all the slides. So there is a video during the presentation. If you cannot hear, please mention in the chat. Otherwise, let's get started.
I believe we have one question from Rebecca. We will go ahead and view. Feel free to ask your question.
Right. So at CSU Health Network, all enrolled students have access to all of the services regardless of their insurance plan. I'll talk about insurance in detail in a little bit since most of the international students, I mean, all of the international students are automatically enrolled in our student health insurance plan. And we'll talk more about that. But all students in CSU have access to all of our services, regardless of whatever plan that they have. We offer integrated care for the whole student, which means we offer not just physical, but we also offer mental health and health education and prevention services. We have 200 plus providers and staff members. So these are board certified doctors and providers that have been with us for 10, 15, 20 years, and they love working with college students like you all. Our services are divided into three categories: medical, mental health, and health education and prevention. So under medical services, we have primary care. So primary care is like a regular doctor's office. Anytime you come in when you're not feeling well, it operates, we do not operate like a urgent care facility, but we operate like a doctor's office where you can make appointments beforehand, and we also have same day appointments. So there are several ways to make an appointment. I'll get to that in a little bit. We also have pharmacy on the first floor. So if you want to pick up your prescriptions, if you want to transfer your prescriptions, you can do that. And it's really convenient for students because they don't have to go anywhere out in the community and they can just pick it up here. We also have immunizations on the second floor. So let's say in the fall you want to get your flu shot or COVID vaccine or any other vaccine. You can do that in our clinic. We also have lab if you want to do your blood test. We also accept referrals from other lab orders from other places, and you can get that done here. We have behavioral health all in the same building. What sets us apart are specialty medical services. So we have dental, optometry. Let's say in spring semester, you want to do your annual eye exam, dental checkup, fillings, All of that can be done. We also have LGBTQ plus care, physical therapy, sexual and reproductive care for all genders, sports medicine, orthopedics, travel medicine. And CSU Health Network has contracts with major insurance carriers. And most of the time, international students don't need to even worry about bills because if it will be most cost effective and cheaper for you to visit the health network. And unless it's an injury or anything, you don't have any copays as well. So, but we'll get to that in a little bit. So mental health services, a part of your student fee already pay for a wide range of mental health support resources at CSU. So we offer brief individual counseling, therapy groups. So you might be wondering, like, what are therapy groups and skill building workshops? So these are um, groups that are designed to give therapy in a group setting. And a lot of students have found it to be really helpful because they think that, oh, it's not just me who's going through this and this, they can relate to other students just because, it's done in a group setting. And research and evidence have shown that in recent years, group therapies have been extremely successful, especially in college settings. And we also have workshops that you can register anytime, anywhere without even having to come to the health network. Our popular workshops are mindfully managing stress, improving sleep. So if you don't even, if you can choose to do it virtually or you can attend in person, but you can do that for free. We also have psychiatric services, drug, alcohol, and youth programs for people who are at different stages of recovery from addiction or alcohol. We also offer post-hospitalization support, I-team, and crisis intervention. And depending on what situation you are going through or what you're dealing with, there might be a therapy group for you. We offer therapy groups for like so many different issues like anxiety, body positivity, succeeding in academics, relationships, trauma, so many different things. And for a full list of all of our offerings, please check out our mental health services webpage at least a week before the classes start, and you'll see a full list of what we offer. But our counseling program is very few in the nation to offer this, and we offer at least 30 to 40 therapy groups every semester, every year. How can you access mental health services? So, mental health services, like I mentioned, is already covered by your student fees. We also offer multicultural counseling services for students who come from different backgrounds, nationalities. It's also a great way for you to find a community. So, for multicultural counseling services, these are like designated 2, 3 hours every day of the week that you don't even need to make an appointment. You just need to come and walk in to our building. So if you go to Google and type in Multicultural Counseling Services CSU Health Network, before the start of the semester, you will see all the times like Monday 2 to 3 or like Tuesday 9 to 11. Those are the times that students who come from multicultural backgrounds can just walk in without even having to make an appointment. So this is a great resource, especially for international students as they are navigating college and like new place and getting adjusted to the new environment and all of that. And like I said, skill building workshops and online tools do not even require any screening process. But other things like individual counseling, therapy groups, for that, you'll have to go through a very brief screening process. And what the screening process looks like is you'll meet with an on-call counselor the first time you come to the health network. And you and the counselor will talk for about 10 to 15 minutes. And in that brief interaction, you and the counselor will decide like what's the best plan for you. Obviously, we cannot guarantee that every student will get individual counseling every week of the semester, but along with your counselor, you can co-create a plan that best fits your needs. And also, it depends on the availability of our counselors. But just know that you don't have to pay anything for mental health services. Sometimes international students come to us and in their third or fourth year of college and they're like, oh my God, I did not want to pay any money. That's why I never came here. If I knew this earlier, I would have used the mental health resources before. So just know that it's already covered by your student fees and you can make an appointment anytime of the semester. I won't go into detail about health education prevention services, but if you are, let's say, if you are eligible to work 20 hours, we offer a lot of student employment opportunities through the health education and prevention services. So if you are, let's say, a biology, health, human science, public health student, and if you want to work for us, and if you're interested in substance misuse prevention, mental health initiatives, well-being initiatives, sexual health initiatives, then you can, all the jobs are posted through Workday, and those are posted at the beginning of every semester. So if you want to work for us, we also hire students. And we also do a lot of like sexual health initiatives and mental health initiatives on campus, which are often led by students. We also give out free sexual health supplies to students. So there are three locations at the health network: on the third floor at the pharmacy, where you can pick up sexual health supplies for free without having to pay anything. So you can please use the resource. And this free sexual health supplies are also available at multiple locations on campus. And we have our business services office on the second floor. So anytime you have any questions about your health insurance, billing, what your medical records, or how does the health insurance work, anything like that, you can stop by the second floor of our building, and there will be a lot of staff members in the health insurance office that will be able to help you and answer your questions. So this is a building that I was talking about all this while, which houses all of our services. It's very, very accessible. It's about 10-minute walk from Lower East Student Center. There is a Max bus stop that runs parallel to our building, so you can take that bus as well. And from LSE, you can also take Around the Horn bus, and it will bring you near the CSU Health Network. There's plenty of parking for patient and clients. So it's pretty accessible. It's located off of Lake and Prospect. So it's that building that you see in the picture. So why to come to the health network? Obviously, for all your medical and mental health needs, and we help you to get healthy, stay healthy. And since international students are automatically enrolled in our student health insurance plan, just know that your annual checkups and all of that is already covered, and you don't have to pay anything. So at the end of the year, if you want to do an annual checkup of your whole body and do a blood work and all of that, I really encourage you to do that. So when are we available? So we are open 8 a.m. to 5 p.m. Monday through Friday. And sometimes during university holidays, we are closed at different for like 12 days in a year. So, and we'll post that on our website. And we also have after hours and nurse helpline, which might be really important, which I'll share in a little bit. So this is our number. If you want to go ahead and save this on your phone, please do that. 970-491-7121. This is the number that you will use to make an appointment. You can also make same-day appointments or schedule appointment ahead of time by going to our CSU Student Health Portal. So I'll show you in a little bit how to access the portal. But if you call the same number, our general number after 5, you can also talk to an on-call nurse. So sometimes, let's say on a Wednesday night or Saturday morning, if you need urgent medical advice and you want to talk to someone, you can call the same number and ask to speak to an on-call nurse, and the nurse will be able to guide you on like what's the best next step for you to do. If it's something that can wait until the next day, you will be, asked to come to the health network the next day. Obviously, if it's life-threatening, you'll have to call 911. But if it's something that can wait, you can take medical advice from the nurse 24/7. And yeah, if you call the same number, you can also speak to an on-call counselor 24/7. So let's say it's Saturday morning and you're having really hard time to regulate your emotions and you're feeling really anxious and you just want to talk to somebody to feel better. So you can call the same number and speak to an on-call counselor for all your mental health needs. Yep. So there's only one number that you need to save for everything. to make appointments for after hours nurse helpline and for after hours mental health counselor. Please save this number 970-491-7121. All right. And then more information about urgent care facilities or emergency care is also available on our website. Okay, moving on. So your health insurance plan that you are automatically enrolled in will help pay for medical services, and your counseling fee is at no cost because it's already covered by the university and your enrollment. So, talking about new student requirements and recommendations. So, all students are required to submit 2 doses of MMR vaccine. And the meningococcal vaccine is mandatory for all students who are living on campus in student housing. So make sure you submit these proof of vaccination by the deadline, which is August 24, 2026, the first day of class. And please note that all the records must be submitted only through the CSU Student Health Portal. We do not accept any printed forms or forms that are mailed to us. So, and if you have any questions about like, I think we're pretty good at also translating the records if it's in another language. But if you have any other questions, feel free to call the same number that I just shared and ask to speak to the immunizations department, and they'll be able to answer your questions. Um, and then um, uh, I will get to all the questions at the end. Moving on. So this is the homepage of our website, CSU Health Network, health.colostate.edu. So over here, you can see the gray bar has a white icon that says Student Health Portal. You'll click on that one. It will take you to this page, which will prompt you to put your net ID and password. And then this is where you'll see all the forms that you will need to fill out. And if you have pending forms, it will show up under here. And you'll upload all your documents in that tab. And then after you start submitting your vaccination records, this is the type of screen that you'll see. The green bar shows that you're compliant with the vaccine, and the red bar shows that you're not compliant with the vaccine. So make sure that the screen is green by the first day of class. So I'm going to play a video which talks about how health insurance works in the United States. And for those of you who don't know, I'm sure all of you have your Instagram account. You can also follow us on our Instagram at CSU Health Network. We also put out a lot of like informative content for international students. And we are creating right now in the process of creating 2 videos, especially for international students about like how health insurance works and what are the myths and facts of the US healthcare system. So please follow us on our social media to stay updated with everything related to health and well-being. But for now, I'm going to play this video and let me know if you cannot hear. Welcome to CSU. We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that
I believe there is no sound on the video. Baruch, I think the video is no longer playing sound.
Sorry, can you hear?
No.
You cannot hear anything?
No,
Okay. Um,
it was playing for the first few minutes or seconds, and now it is no longer playing sound.
it was playing for the first few minutes, you said?
Seconds.
Oh, okay. Okay, let me try. We have this video on our YouTube, so let me stop this share for one moment, and I'm going to play from our YouTube, and hopefully that will work. Give me one moment.
While we are giving you a second to get set up, I do want to remind everyone, if you have a question, post it in the Q&A. So if you have a button at the very bottom, it says more. It's a circle with three dots in the center. Click on that and the Q&A feature will show up if it is not already on your toolbar. And you can put all your questions there. We will get to them at the very end.
To meet Health Network. So I'm going to try to share the screen again and play it from YouTube this time. I'm not sure why I was doing that, so let me know if you can hear, and I'll try something else. Share. Okay.
Yes, so I think you might have to keep your mic on. That way we can hear the sound.
Okay. Can you see my screen?
Yes.
Okay. Welcome to CSU. We are happy you
The
are here.
video is not showing on your screen.
Health
We just see your
Network,
main
your
screen.
home okay, give me one minute. We provide med. Thank you for being patient while I'm navigating all of this. Okay, let's try. Welcome to CSU. We are happy you are here. CSU Health
The
Network.
video is not on the main screen.
We provide medical, mental health, and health education and prevention services to students. Sorry, you said you cannot see my screen?
No, we can just see your background. We do not see the screen of the video.
Okay, let me try that once again. Okay, let's see. Okay, can you see the?
Yes, we can see it. If you want to start from there, I think it should be okay as long as you don't mute yourself.
Okay. Welcome to CSU. We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that accessing healthcare and using health insurance in the United States works differently than in your home country. This video will provide information about using health insurance in the United States and specifically how your CSU Student Health Insurance Plan, also known as SHIP, will work. In the United States, there is no universal health care, and people must purchase their own health plan to help pay for care when medical needs arise. Even so, when you visit a doctor, insurance will usually not cover all the costs. Most of the time, people will pay some amount when receiving health care. Because healthcare in the United States works differently than in other countries, it is important to define some common health insurance terms. A healthcare provider is a licensed medical professional or healthcare organization that provides medical services or treatments to patients. Deductible is a set amount of money you pay each plan year for covered healthcare services that you have received. Your health plan will begin to contribute toward the cost of care after the annual deductible has been met. Once the plan year deductible is met, you will still share in the cost of your medical care. This is when you may hear the terms coinsurance and copay. Coinsurance is a percent of the cost. You and your insurance plan will each pay a percent of the cost of care that you receive for medical services. A copay is the amount that you pay after your deductible has been met for a particular service each time you get that service. Now we'll talk about in-network and out-of-network care. In-network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor or facility, such as the CSU Health Network. Out of network means that the provider or facility does not have contract or have a financial agreement with your health plan. Out of pocket maximum is the most you will pay for covered healthcare during a plan year. Once the out of pocket maximum has been met for the plan year, you will not owe anything more for covered healthcare during that plan year. Plan year is a 12-month period of time during which deductibles, coinsurance, and copays accumulate toward the out of pocket maximum. CSU SHIP's plan year is August 1st to July 31st. Out of pocket costs are your expenses for medical care that are not covered by your health plan, including the deductible, coinsurance, copays, or non-covered services. For CSU SHIP, international students have a $500 plan year deductible when medical services are received outside of the CSU Health Network with in-network providers. There is no deductible to meet when you receive your medical care at the CSU Health Network. When you receive medical care at the CSU Health Network, you may pay a low copay for some services and no cost for other services. When you use an in-network provider, you will pay a smaller deductible, $500, and coinsurance, 20%. When you use a healthcare provider or facility that is out of network, you will pay a larger deductible, $1,000 instead of $500, and a greater percentage of the cost, 40% instead of 20%. Because healthcare in the US can be costly, it is most cost effective for students on the CSU Student Health Insurance Plan to start their care at CSU Health Network if possible. You can think of CSU Health Network as your on-campus doctor's office. When you access medical or mental health care at CSU Health Network using your SHIP insurance, you will have very little or limited out-of-pocket costs. This is because for students with SHIP, the deductible does not apply for services received at CSU Health Network. CSU Health Network offers a variety of general and specialty medical services, including dental, vision, immunizations, primary care, pharmacy, physical therapy, and more. To learn about all of the services at CSU Health Network, visit health.collegestate.edu. Your CSU Student Health Insurance Plan is also in network with many providers and facilities in Colorado and the United States to make it convenient to find care at the lowest cost. When healthcare services are received outside of CSU Health Network, students enrolled in the CSU Student Health Insurance Plan will have a deductible to meet and then either coinsurance or copays depending on the service received. Specific details about what you can expect to pay under the Student Health Insurance Plan can be found at health.colostate.edu/international-ship. As you learned earlier in this video, we encourage you to visit in-network providers whenever possible. If you are looking to find an in-network provider off campus, staff at CSU Health Network or your health plan customer service department can help you. Once enrolled in the student health insurance plan, you should carry your insurance ID card. It can be downloaded to your phone or computer, and you can find instructions on how to download your insurance card at health.colostate.edu/international-ship under the Quick Links section. You should show your health insurance ID card when receiving healthcare so that the healthcare provider can bill your insurance. The insurance ID card also has the insurance customer service phone number on the back if you have questions about healthcare services or providers outside of CSU Health Network. If CSU Health Network is closed or you have an urgent or emergent need, you should seek care at a local urgent care or emergency room. Be sure to bring your insurance ID card. If CSU Health Network is closed and it is not an emergency, the CSU Student Health Insurance Plan also offers online, no-cost medical or mental health appointments 24 hours a day, 7 days a week. More information on accessing online care can be found at health.colostate.edu/international-ship. If you have questions about the CSU Student Health Insurance Plan, please call 970-491-2457 or email chuhn_insurance@colostate.edu. Thank you for watching. Thank you so much. I am going to get back to our presentation. Welcome to CSU. I'm pulling up our presentation right now. One moment. While I switch from one thing to another. Okay. All right, showing it. Right. Right. Can you see my screen?
We can.
Okay, great. So talking about health insurance, like I said, it's required for all students. You're automatically enrolled in the CSU Student Health Insurance Plan. If you are a student who is sponsored by your government, then you'll have to submit a financial document. But for that, you'll have to contact Office of International Programs. So that is the only case that we accept waivers if your government is already sponsoring your health insurance plan. Other than that, there are very, very few health insurance that are provided by your employer or through their government that are accepted, and you have to meet a lot of criteria. So I think it's in your best interest to be enrolled in the SHIP plan, which is sponsored by the university. So moving on, so the deadline to submit a waiver request form, if you have, is September 9, 2026. And the approved waivers are employer group health plans, sponsored plans, and plans that meet the healthcare reform law. And if you want to know more, go to our website and type in International Health Insurance Plan, and you'll see all the requirements in our website. So moving on, all international students are also required to submit and complete online module called Alcohol EDU. Alcohol EDU is a training program provided to students so that you have better knowledge about how to take care of yourself and of your peers while you're out drinking or during parties. It also talks about like party regulations in CSU and also in the city of Fort Collins. You will get an email to your colostate.edu email address after you register for classes. So all you need to do is open your email and complete the online module named Alcohol EDU, which is mandatory, and the deadline to do that is August 24, 2026. If you fail to complete this module and also submit your immunization records by the deadline, then there'll be a hold on your student account and you won't be able to register for spring courses. So make sure you complete this by the deadline. There's also an optional module called Canvas Financial Wellness. So if you want to learn about, okay, how does a credit card work? Like how to save money, how to do budgeting, how to work with banks, how does banking work, and all of that, I also highly recommend for you to check out that module named Canvas Financial Wellness. And like I said, all of these will be emailed to you after you register for classes. And then that brings me to the end of the presentation. If you have any questions, I will get to questions one by one now, but please save the phone number if you haven't already. And also visit our website at health.colostate.edu. And yeah, come see us. We are open. If you get here before classes start, you can also come by and stop by our Health and Medical Center building anytime 8 a.m. to 5 p.m. Monday through Friday. So right now I am going to stop share and then go through the questions. And then to answer some of the questions, I might put in some links for you in the chat so that you can get more information. So let's see. The first question in the Q&A, does CSU health insurance cover contact glasses or only normal glasses? Yeah, we also cover contact lenses. So that's been answered. Can I submit my records in another language that's not English and you can translate it? Yes. Like I said, um, we are pretty good at transcribing it in another language. And if for some reason our team cannot prescribe it, they will contact you. And if you don't hear back, then please call our general number and speak to the immunizations department. But if you have a translated one already, it makes it much easier for us. So just try uploading that. And then let's see, the meningococcal vaccine is also for university apartments. So I know for sure it's mandatory for people who are living in dorms in student housing. So that is mandatory. But for university apartments, if you get an email, or if you see it in your student health portal, then you can call our CSU Health Network. But as far as I know, I think it is only for students who are living on campus in the campus premises in the dorms. All right. So there is a long question about the blood test result, uh, blood draw. Okay. So there was a question that they said they was gonna cost $66 for blood draw and $5 for lab test. And if they are under SHIP insurance and graduate assistantship, whether the lab test fee will be covered by the insurance or out of their own pocket. So, uh, So if it's like if it's for an annual checkup, which is done once a year as a preventative service, those are covered by your health insurance. But if the professional if it shows on your portal that you'll have to pay like $5 copay, yeah, because it might not be part of a routine test, but it might be for a specialty purpose. So for that, you'll have to pay that fee if it shows up on your health portal. Does the health insurance cover vaccination? Yes, it covers flu shot vaccination once a year. And then yeah, all the things that come under like preventative care, it covers all of those vaccinations. If you want to know exactly the full list of like what vaccinations are covered, go to our website and type in immunizations, and you can see the full list of what we cover. Um, I did all my immunizations during my master's program. Am I required to do that at the beginning of the PhD program? So if you are in continuous enrollment, that means if you didn't take a break in between, those records will still apply as long as it's within the 5 years. So more than likely it will still be applied, and it will still, and if you're not compliant anymore, you'll get a message in your health network portal or an email. Okay, there's a question about MMR virtual orientation. So it looks like Uh, it's a technical issue with getting a non-medical exemption certificate. I would suggest just call our number, general number, and speak to someone in medical records, and they will be able to help you on the phone right away rather than trying different devices and ad blockers. Just call our phone number and speak to the medical records department, and they can help you. Or you can also stop by our office if you're here. Thank you. Can I do my immunizations at the CSU Health Network upon arrival at campus? It's kind of difficult to get them in my country. Yes, you can do that. Yes, that's possible. All you need to do is schedule or make an appointment and come to our immunizations clinic. I have a question regarding the TB screening requirement. I've completed the TB assessment form since I've lived in China. I was recommended to complete a TB test. I've uploaded the result about a week ago, but I have not received any update yet. Could you please let me know if I need to wait for processing? Yeah. So usually it takes our staff anywhere from 1 to 2 weeks to process your record. So if you don't see the change reflect immediately, then I would say just give it one more week. And if you don't hear back, you can also email us or call us, or if it is easier, you can also go to our website, the homepage, and at the bottom, there's a contact form. So you can just fill out your name, email, and write your question or your concern or whatever you're going through. And then our health network staff members will be able to take care of that and take it from there. But it usually takes about like 1 to 2 weeks. And I think at this time of the year, we're really busy with so many students sending us records, like thousands, like 5 to 10,000 students sending us records every. Um, so yeah, our TB test required for all students. So if it is required, it will show up in your student health network portal. So, and you'll get an email. Because I think there's a list of countries that fall under like, oh, you have to provide TB assessments, and there are a list of countries uh, that are not. So you'll see it in your portal. Um, yeah. So how to take meningococcal vaccine from the health network? All you need to do is make an appointment or come to our clinic on the second floor. Or yeah, if you are outside of the country, just go to the bottom of our homepage and write to us, and then you can schedule an appointment then, or you can email us. There are multiple ways to do that. Thank you. So there's another question about I go for an eyesight and dental checkup every 6 months. Are the covered and only provided once a year? Yeah, so the annual checkups are covered only once a year. So I think if you do them twice a year, you might have to call the health insurance department or email them at csuhn_insurance@colestate.edu, and they can tell you exactly what the second one, what the costs are going to be like or the copays are going to be like. And then I sent the TB test 4 weeks ago, didn't have any respond yet. I would say check your portal, and if not, like I mentioned with other students, just use the contact form to email us. Or, like I said, I'm gonna put it in the chat. You can email our insurance department directly at. I'm going to put the email address in the chat. Um, CSU. Oh, okay, I'll do that in a little bit. But yeah, just use the contact form at the bottom of our website. And usually what it does is it reroutes the message to the department that you're trying to reach. Um, yeah, so if you go down to our homepage, there is a link that says Contact CSU Health Network. And then I'm going to put that in the chat right now for everyone. So please use the contact form. Yeah, so you're right. Since students are automatically enrolled for health insurance, you do not need to take any action. You are automatically enrolled, but the case is different if if you have a sponsorship from your government or like other waiver things like that. But if you are already enrolled, then you don't have to take any action. Maximum amount of individual brief counseling sessions students can have free access to. So that's a great question. So like I mentioned in the presentation just now, we cannot guarantee that you will get like, okay, 8 sessions, 10 sessions every semester, anything like that. It really depends on the availability of the counselors at that moment and your individual needs and identities and your all of that. So I think anywhere from 6 to 8 sessions are typical for most students, but we cannot guarantee that. But when you come and see the counselor for the first time, they can find the right plan for you. And that might be a therapy group or a workshop or individual counseling. You can access all of those services, but it really depends on the availability and the capacity of our counselors at that moment. There's another question about I've submitted my immunization form containing the MMR 2 doses, single dose. My profile only shows fulfillment of MMR. Yeah, so just wait for like a couple weeks, and if you don't hear back, then use our contact form that I just shared in the chat, and then they can help you.
I did just want to jump in there because we get this question quite a bit about immunizations. A link was sent in the chat, everyone. Take a minute to go through it and read it. There are some countries that only give a certain dose, but we like to kind of put it all together. So it's measles, mumps, and rubella vaccine, meningitis. Well, I'm probably going to butcher this one. Please go ahead and correct me if I'm wrong, but meningitis.
Coco.
Coca-Cola. Okay. Sorry, very difficult word. Some countries do them differently and they administer them differently. So if it doesn't meet Colorado law, you will have a hold. Make sure you connect with the health network to see if that is the case. Again, it is a very busy time period, but make sure you are in communication before you start school and before all of these vaccines are required, because there will be hold put on your account for either if you're living on campus or for you to start school if you do not meet some of these requirements or you don't have an appointment already set up.
Right. Thank you so much. And also thank you for putting the link of our immunizations page on the chat, Hazar. I really appreciate that. So same questions, add proof and results, need to repeat again. So yeah, as long as within the last 5 years and you didn't get any message in the portal or email, you're good to go. Does meningococcal vaccine mandatory for GTA international students? So like I mentioned, if you're living in the dorms and student housing, and if it's mentioned in your health portal, then it's required. But if not, you are not required to do that. I am on prescription medication. Is this going to be covered under SHIP? For that, you'll have to call the pharmacy by if you call the same number 4917121, and asked to speak to one of the pharmacists. They can help answer your questions or use the contact form mentioned in the chat. Is there a way alcohol EDU orientation as a grad student for awareness? If so, where can I find modules? So like I said, after you register for classes, you will get an email automatically to your colostate.edu email address at least like 4 to 5 days after you register for classes. And then that's where you will find that link to complete the module.
Well,
The
I do want to add in there, it is only required for those 23 years old or under.
Yes.
If you're older, you do not need it. It is not a requirement. But if you want to know more, there are quite a lot of events that happen throughout the year to give you alcohol awareness. So that is an option if that's something you want to learn more about, but it is not a requirement if you're under 23 years old.
All right, I got the MMR vaccines, but don't have any records of them. So I have immunogenicity and the results, but I don't need the MMR requirement. Yeah, so for that also you'll have to contact the immunizations department because I don't want to give you wrong information. And then right now, because of staffing issues, I think they're like short-staffed right now, so they might be taking a little bit longer to respond to your inquiries. All right, so I think. Can I get a free vaccine? I'm going off of the questions in the chat. Can I get a free vaccine injection? Yes, you can. I already covered that one. So I think, did I miss
I
any?
don't believe so. We asked everyone to put them in the Q&A. If you have any additional ones, feel free to put them there. Common questions we get asked is when do my benefits start and how do I make an appointment?
Yeah.
If I do need to get vaccinations or any other things.
Yeah. So if you're under SHIP, your coverage starts as early as August 1. And you don't even need to wait until your classes start. Your access to our building starts a week before classes start. So if you want to start making those appointments, transfer your prescriptions, you can do that, for a week before classes start. And then in order to make an appointment, I already mentioned you can either call us by in that number, or you can go to the student health portal and make appointments. And I also want to highlight this once again. If you have questions that did not get answered here, you can also follow us on our Instagram at CSU Health Network. And we also take questions, and your questions will remain confidential and will be answered by the department or the provider that you are looking for. So, if that social media is easier, we have found that students obviously check their social media more than they check their emails these days. So, if you have any questions, um, you can do that. And yeah, immunizations are given to students by appointment only. That is true. Walk-in services are currently not available. Yeah, because of staffing issues, it might change in the future. We don't know, but that's that. But that is the way to make an appointment. I know we're almost done with time. I get one more question. So, can I get covered during summer for the SHIP plan if I am on campus? During the summer I decided to on campus. Yes, yes. I think you will get summer. If you are taking summer courses, you don't have to pay any co-pays, but I think there's like a mid-semester access fee if you are if you are not taking any classes or if you're not working. So, yeah. All right. Is that everything? Okay, yes. Um, yeah, if like I said, feel free to go to our website, use the contact form if you have any questions. But thank you for having me present to all of you, and thank you for being patient as I was navigating all these things with the technology. And then I'm also happy to will be at the International Resource Fair. And where we'll be giving out a lot of like information, swag items, flyers, and brochures. And you can also come see us there if you have any questions on August 18, I believe, morning of August 18th. So, yeah, see you all there, and thank you. Bye.
Thank you, everyone. Again, as Arisha has mentioned, they will be at the resource fair from 8 a.m. to 8:45 a.m. Please come check them out. It is mandatory orientation date, so you will be there. So if you have any additional questions you'd like to ask in person, feel free to do so. Bring any of your documents if you have any specific questions, and they will make sure to be able to answer as many as they can. But thank you everyone for joining. We will be sending out the Zoom recording. Have a wonderful day and see you all.